This is Product by Design, a podcast by Prodigy, where we explore technology, artificial intelligence, user experience, product management, and the philosophy of building products and companies. All right, welcome back to another episode of Product by Design. I am Kyle, and this week we have another great guest with us, RJ. RJ, welcome to the show.
Thank you, Kyle. Thank you for having me today. Looking forward to it.
Yeah, looking forward to it as well. Let me do a brief introduction for you, and then we can let you tell us a little bit more about yourself. But RJ is the co-founder of Estenda, a leading company specializing in custom software and data analysis for healthcare and medical companies. So I know that there's a lot more to talk about, but why don't you tell us a little bit more about yourself before we do?
Yeah, absolutely. I got started many a year ago. It's scary to say. I realized last year was my 30th anniversary of college graduation. So been around for a while. We got lucky at an early age. I was interested in technology, computers. I went to school for computer science. Interestingly, I almost got a PhD in artificial intelligence back in the 90s. But instead of doing that, I got a job offer, and it was like actually go out and make a living or take on a lot more debt. And I went out and made a living, but always was able to keep my hand in technology and AI related fields and stuff like that over the years. It's one of those things that people forget. AI has been around for quite a while, going back to, 40s and 50s even. But I've always been fascinated with what technology can do. And, my parents bought me an IBM PC Junior way back when. And I played my fair share of games. I had the Atari too, don't get me wrong. But yeah, just fascinated with the power of technology and how it can make a difference in solving problems. And that's what I love today. So through the 90s, I worked through various different corporations, consulting companies. In the early 2000s, I started my own company with a good friend, Drew Lewis, called Estenda Solutions, and professional services focused on custom software development, data, and AI in the healthcare space. So we really got our start with a congressional grant for the development of a diabetes disease management solution in military healthcare. So we were working with like Walter Reed Army Medical Center, the Boston VA, some of the premier institutions in the area of healthcare. Fascinating early journey to be part of that. And, fast forward 22 years later, we're still going strong, solving problems, trying to make a difference in the world.
That's incredible. And I'm excited to talk more about that because I think there's so much to touch on with that specifically and some of the other things that you're working on. But before we do, what else do you like to do outside of work and outside of the office?
I laugh because of what I'm about to say. I train and race for triathlons, a big passion of mine. And I was on a podcast 6 months or so ago, and the host essentially had a stopwatch because she knew this was in my background. She's like, how long is it going to take him to mention this? And it came up naturally in the conversation. But that definitely is a big part of my life. And that actually led to one of the bigger outside of work projects I'm working on now, in writing my first book. And it's called Productive Harmony is the working title, but it's how to use and focus on energy management instead of time management. Interestingly, time management's an artifact of the 20th century. There's this guy, Frederick Taylor, who came up with sort of the godfather of it in the early 1900s, started this process of really fine-tuned scientific approach to management time. He got fired in that first job because it wasn't improving productivity, which was just fascinating. It was like, everyone's like, time management, this is the way to do things. And then it sort of gets lost to history. He got fired because wasn't working out. But yeah, fast forward, 100 plus years, we're still talking about time management, and it's really about energy management. I experienced that in, training in triathlons, but just everyday life, as you get up in the morning and you need to be productive. And, I'm a morning person, so there is this idea of chronotypes where, you're morning person, evening person. Most people are somewhere in the middle. But from a morning person perspective, I should be focusing on things that need a lot of thinking and thought process. Through lunchtime, it's more, things slow down, look at email, things that don't need a lot of attention, a lot of focus. And then in the evening, it's around creativity, which my wife doesn't like because then it's like, time to eat dinner. I'm like, oh wait, I just got this great creative burst. I gotta get this down. I gotta get this down. She's like, no, I'm hungry. We gotta eat. So yeah, I'm midway through that journey and anticipating the book coming out sometime in the fall. So that's a whole nother journey. And as my wife says, you need to take some of your own advice and not do too many things all of the times. Trying that out for once.
Yeah, I'm I'm interested in that. Just to touch on it a little bit more, what have you found to be the most interesting takeaway as you're kind of looking into this book and studying time management versus energy management? What, as maybe like a little teaser, like what is one or two or a few of the most important key things that you found that may be different than the way we think about it?
Yeah, at the very highest level, sleep, nutrition, and movement matter significantly. So getting 7 hours plus of sleep, eating well and moving. I'm very cautious of using movement as a word and not exercise because I know and realize my, regimen is much higher than the average person. That's not necessary. You don't need to go out and run a 5K. It's going for a walk is good. Even as you are working on a project and get stuck, it's a brilliant move to just get up and go walk outside for 10 minutes. Sort of reset. And the key to that is the reset. Don't go walk outside and think about the problem. Don't go outside and have a phone call about something related to work. Like separate from it. And that's where you're getting that mental break from what you're doing so that you can come back to it. Other big ideas are really, which I even discovered as part of writing the book, and this fascinated me as I did it for myself. You sit here, and I don't know about you, but I have my cell phone sitting next to me. Okay. That is a distraction. Even if you are not actively using it, that is a distraction. So I've gotten in the habit of putting it into the next room. And so then it is out of mind. And that made such a significant difference. It was sort of amazing to me when I was in this, okay, I got to really buckle down and write the next chapter in the book. Not having that in the room, not having that draw of like, ooh, what am I missing? The idea of FOMO kind of thing. I turn off all notifications. So I don't even have that, but it's still like, ooh, what's going on Instagram? What's going on X? So just getting that out of there are two huge points.
I love that advice. One, I find that taking a walk, especially a midday walk for me, is such a great reset. And the second being, I find myself, and I've noticed this happening more and more, that I will just subconsciously, without thinking, like reach for my phone. If at various times, like I'll be doing something and then stop for a second and I just find myself reaching for it. I'm like, no, that now is not the time, but it just becomes like such a habit that all the time, like if there's a pause, it's just reach down for the phone and like, no, that's not what I should be doing. I need to, and I love the idea of like just getting it out. Don't have it in pocket or on the desk because then it's just so easy to reach for it when that may not be the thing that you want to do. Great. And we've had a couple triathletes that I've talked to, and I like to ask the question, is there a part of the triathlon that you like the most and the least?
The biggest thing for me in triathlon is the mental challenge. So there obviously is a strong physical component and endurance of swim, bike, run, but it's really about that mental challenge of doing that. And I say I race triathlon because, and there's nothing wrong with people go out there to just do it and compete. That is a significant physical accomplishment to just go out there and complete a 5K. It doesn't have to be a triathlon to complete a 5K. That is a significant accomplishment. But I'm out there, it's like, it's particularly if I'm paying to do one of these triathlons, I want to go out there and see how hard can I push? How fast can I push? And that mental aspect is even getting up, at 4:30 this morning, going to the gym because it's like 10 degrees outside where I live. Not quite safe enough to run outside. So, I'm off at the gym and you run on the treadmill and jump in the pool and swim. There's that mental challenge to that, and the resilience to go through that has been huge as part of it. So yes, that is definitely the part I love about it. Um, if I had to pick one, it's probably swimming. Not hugely into swimming. Interestingly, I didn't grow up swimming, And so I was, adult onset learning swimmer. And I wasn't very great. I was back of the pack. At the time, this was years ago, my 10-year-old, who was on a swim team and was learning how to competitively swim, helped coach me. And she just loved that fact because it was like, Dad, go do this, give me 10 laps, and then come find me on deck. Little Miss Bossy worked perfectly for her. But now I finish in the top third, like I'm not winning any swim races, but I went from the bottom of the pack to like the top third through a lot of her training and, my own, improvements over the years, but it made a big difference. So
That's
kudos to her.
great. Yeah, I love that. All right. Well, I want to dive into some of the things that you mentioned initially as you were kind of giving us a little brief overview and some of the things that you're working on. But as we do that, I would love to hear a little bit more about your journey, how you got started into entrepreneurship in general. Right now you're the co-founder and COO, and you've also done this before. So, what kind of set you on the path of entrepreneurship?
Yeah, I actually created a second company years ago, and we shut that down. And unfortunately, raised some capital, just didn't really take off. Software related. Also started like a baking company prior to that. That had like a 2-year run kind of thing before we shut that down. And we were like, baking, what does that have to do with anything? One, it was part of like the triathlon racing and needing to maintain calories out when I was running and stuff like that. It's like instead of buying all the stuff that's out there, it's like, okay, what can I create for myself? And then having young kids at home, it's like, oh, this is just fun. So it did go off and do that. But baking is very scientific. It's like when you're cooking, there's a lot of leeway. It's like, oh, add a little more salt, a little more pepper. And with baking, you can mess it up pretty quickly if you don't follow a recipe and formulas and ratios. So that's why the baking. But it's the idea of the entrepreneur of solving problems and in being my own boss, which is interesting because I still do have bosses. My clients are my bosses. You don't completely get away from the idea of having a boss, but I do have a lot more control and influence, obviously, of where we're going, what we're doing. And healthcare was just that idea of like, okay, I can solve problems, but and I've created the inventory systems, I've created accounting systems and a railroad car scheduling system, which was a fascinating challenge to get the railroad cars to where they needed to be, but yeah, important, but not very meaningful. Healthcare, there is definitely that aspect of giving back and making a difference in the world. It's like I, as an individual, can now help build software for companies that are then, deploying this and selling this to thousands, if not millions of people or to being deployed to health systems, helping lots of people. So in my small little way, we can make a much bigger impact.
Yeah, that's great. As you've gone through and, founded your current company and some others, what have you found to be some of the most important factors in doing that that lead to success?
You think of two things. One, a clear sense of purpose. What are you trying to accomplish? What is your goal? And hopefully that aligns with the market dynamics and market forces that are out there. And it's beautiful when those two things come together. And if you're really pushing the boundaries, the edges, you might have to, really figure out what that market fit is and change and adapt. But that clear sense of a purpose, what are you trying to accomplish? And second, I would say a strong support structure. If you are in a relationship, if you have a family, friends, colleagues, extended support network, who's going to support you in that effort? Because it's interesting, as I'm writing this book on productive harmony, that becomes really difficult when you're in the throes of being a startup. You do need to put in long hours. So it's finding that harmonious relationship with the other people in your world and recognize that, okay, this is what we need to focus on now. And I've been lucky to have a very supportive wife and children as part of my journey. I did, again, not talk about triathlon, but I did an Ironman triathlon years ago, and it was like the whole family was invested in it. From that entrepreneur perspective, it's like, okay, you're going to start a business. This is the focus. I'm not going to be there as much as I was before this kind of thing. So you do need that strong support structure and understanding.
Yeah, I think that those are some great points on not just the building of a business or a startup, but also other areas that may be very similar in life. So I want to touch a little bit on healthcare and the things that you're focused on right now. What do you see as, as you're working with what you're doing right now? Uh, how does AI play into that? And what do you see as maybe some of the biggest challenges right now within the healthcare industry?
How much time do you have? Uh, so from an AI perspective, I split it into sort of two grand categories. One, I think of it more as old school or the forgotten machine learning AI, which still very much has a focus in the world. And you see that a lot in image analysis or image processing. So if I take an image of the retina of your eye, this is one of the projects we've been involved with for 20 plus years now, is the detection of diabetic retinopathy. And there's a camera that takes a photo of the retina of your eye, which is the back of your eye. And diabetic retinopathy is one of the leading causes of preventable blindness. So if we find it, then it is very treatable. Typically, a human looks at those images, but we don't need a human to do that. We can use the power of AI, computer, and technology to look at those images. And you first think about a go, no go sort of decision of like, there is incidence of disease here where there's not, kind of thing. Okay, so let's triage all of these. The 90% or whatever that we're looking at today have no incidence. Okay, you're done. Nobody had to look at those. Then the others that do have incidents, have somebody look at it. And okay, in terms of retinopathy, then you grade it in terms of severity to then figure out which patients that you want to help first. But the computers can also do that. The AI can do that. The interesting part about these algorithms is they're very specifically trained on the type of image that you are using. So as the technology improves over time, those original AI algorithms aren't going to work as well, if at all, anymore, because that image looks differently. And the same thing just happens when you go from institution to institution in terms of data and what information is available in the EMR. One institution can code, a patient encounter differently than another. So an AI that's trained at the first place isn't necessarily going to work at the second. And even if you look at like populations, if you're an inner city population, I live just outside of Philadelphia, that inner city population in Philadelphia is going to look different than Southern California. And so the AI algorithm that was trained and learned on one population, you need to test it in your local population to make sure it works. The FDA commissioner has literally said like the use of AI in healthcare needs to be a partnership. They don't have the resources, the capacity to test all of these systems to make sure that they are safe and effective. So that is a big use case for AI, but also like a big challenge. Where AI's then we fast forward to 2 years ago now, I guess, when generative AI, large language models, became a thing. That's quickly becoming the second sort of big use case. Ambient listening, so if you use WebEx, GoToMeeting, any of these things, these tools that take notes for you, that's what the ambient listening technology is doing in the doctor's office during the visit. So instead of the physician facing the computer and typing away in notes and not paying attention to you as an individual, they're trying to take notes. Let the computer do that. Let the AI take those notes. And so that's a quickly, has become the probably biggest use case of generative AI in healthcare. That patient summaries is another big area where it's being used. The challenge, interestingly, in the risks is that it can hallucinate. It can make up stuff, can make mistakes. What I find interesting, there's this idea in AI of saying, okay, we're going to solve this problem 5 years from now, maybe hopefully, sooner. We're going to solve this problem. I don't necessarily know that it needs to be a solved problem because human scribes make errors. So to address the idea that physicians shouldn't be sitting there typing, should be paying attention, should be interacting with the patient, a lot of practices, health systems have human scribes in the room to be able to do that and take notes and everything like that. So great use case. those humans make mistakes too. There are processes in place then to make sure the final output is good. And so let's use those same processes in place on the AI and what it's creating and generating. So now you've saved massive amounts of labor and resources. The system becomes more efficiency and you're using your existing processes. So I think we sort of have to embrace the generative AI where it is today and use the power of what it's capable of today, recognizing that it does have challenges. And let's put the processes in place. There's a reason for the idea of second opinions. If you go to your doctor and get a, it's like, oh, no, that's a serious, let me go get a second opinion. Humans aren't right all the time. So let's embrace what it's capable of doing and acknowledge the idea that it can make mistakes.
I think you've touched on some really fascinating points, especially around a number of them, the model training and how some of these things have to be very, very robust. I know as I've been working on a number of projects where we have been training models, AI models on specific sets of data, very, very tailored to an organization. You don't necessarily get the universality of, this can apply to everybody because it's obviously trained on the way that we're doing things as a business. And I think that's a fascinating thing because you touched on different populations having different things and different companies and hospitals doing things slightly different, and how that impacts how universal, if we made like a retina scan AI evaluation, it doesn't necessarily translate immediately to everybody because there's these subtle differences. How do you see that being, one, a challenge, and then how are we overcoming some of those challenges in that example and more broadly of really using technology to augment a lot of the things that we possibly can do, and overcoming maybe some of the objections that maybe some people might have about using that instead of a doctor evaluating it or a doctor typing notes.
Yeah, it's definitely still a challenge, not a solved problem today. It's probably even going, in my opinion, somewhat of the wrong direction. So you're seeing more and more healthcare systems taking the data they have and packaging it up as a service offering. So I recognize the need for these institutions to make money to stay in business and provide healthcare. Yes, absolutely essential. But by firewalling, paywalling that data such that I can't use it to train an algorithm becomes challenging. Okay, the numbers that I've seen are cost prohibitive to startups. You have to have significant backing, and I won't name any specific institutions, but you need significant backing to then get access to that data to be able to have a variety of information, variety of populations, such that you can better train a machine learning algorithm. So I think this sort of has to level set, and that'll work out over time. A growing concept to take on this challenge is the idea of creating synthetic data. And we've done, even before the days of AI, we've been involved in some projects in creating synthetic data just to test the systems that we were, it's you're developing a system and you're expecting millions of records and sometimes billions of records. You get into performance challenges. So you need to create data that's representative of what you expect. And obviously in healthcare, it's one thing to say, okay, here's a blood glucose trace of a person that we artificially created. That, you have to apply a lot more science to it to create something that is realistic. And then, as you start bringing treatments to that, okay, what does it happen in real life? So you still have to get into like the clinical trials. But yeah, the idea of synthetic data can help overcome some of these challenges.
Right. As I'm continuing on kind of this thought of technology, specifically AI, but other technology that we're using in healthcare specifically, what do you see as either the best or possibly underhyped things that are happening right now? And where do you see things that you just don't see panning out as much? And there may be a little bit like overhyped as far as what it's going to be able to do versus some technology that has real potential for the future.
I'll go with AI in specifics for both of those answers. I think Gen AI is still underhyped. And a lot of people are like, is it overhyped? I think it's still underhyped. Even where it is today, And numerous people have now said this, but it's like as you interact with the various large language models, regardless of which one it is, that's the worst it's ever going to get. It's only going to get better, and what it can do is amazing today. I use it every day. Overhyped. There's this newer concept of agentic AI, where an AI system is capable of going off and solving problems on its own. We'll get there, but that's definitely overhyped right now of what it's really capable of doing, or the cost of doing that. ChatGPT, OpenAI, they're the biggest sort of the benchmark out there for what they can do. They're releasing various different agentic models and the new reasoning models. And I pay for the $20 subscription of to get the better service kind of thing. And now there's like a $200 level to get the reasoning model. And that gets prohibitively cost expensive for me as an individual to use. But fast forward a little bit of time here, and it's probably not that long, but fast forward a little bit of time, and if it costs $500 a month or $1,000 a month, that sounds like a lot. But at what point can it replace a person, an individual, and you're not paying a software developer $100,000, $120,000 salary? You're saving significant money then. It's not quite there yet, particularly the agentic AI. Even the terminology is probably pretty new. That's definitely in the overhype category right now. It's just, yeah, you can find some use cases, but it needs to mature a little bit more.
Yeah, it's definitely an exciting area, but I think you're right. It's very, very new. And how much can you employ that sort of technology like an agent in order to do the types of things that you would want to do, like kind of opening up, here's my computer and all my documents, do this thing for me, take these spreadsheets and combine them and all of that. It seems like it's a fascinating area, but a little ways to go still before you can do that sort of thing.
Yeah, little ways to go. Like we have like a time tracking system at work, and I really like how it operates, and it's aging, so it's time for us to explore and look for a new option. And I don't like the way the general time tracking industry has gone, where it's like clock in, clock out. Like that's not how we operate. It's like, okay, how many hours a day did I work on, project X? And it's not that I work from 8 to 8:30, 9 to 9:30. That's just not our model. And so I haven't found one that really works from that capacity, or they're just so they're exorbitant in cost perspective. $10, $15 to track, per employee per month to track time. So I'm on this mission to use the various tools that are out there to hands-free, without coding, use the apps in the AIs to create that application. They're not there yet. I have been fascinatingly surprised by what it's capable of, and how just through a natural language interface and talking to it, of how it can update the model and the user interface and stuff like that. It is fascinating. But I got stuck the other day. I asked it to add, a particular feature to the screen to be able to pick a date, and it's like, okay, done. But it didn't do it. And then I was like, you didn't do it. And then it just kept responding, oh, we did that already. And I got stuck in a loop, and, it was an early vendor. There was no sort of like refresh or go back to previous step or undo. And I got stuck, and it was like, I did that already. You didn't. So they're early, but it is fascinating where it's going to go. And as a field, software development and programming, it's not going away, because you still have to know what to ask it and what to tell it to do. It's not going to go off and be like, hey, create me a time management application. What features does it going to, what do I want? What am I going to uniquely add to it? So yeah, software development as a profession is not going away anytime soon, nor are doctors.
Yeah, very, very true. As we look at AI generally, I'm interested in kind of your take on how do we use it responsibly, whether it's in healthcare or outside? What are some of the things that we should be thinking about generally? And then, since you're very much in the healthcare space, what are some of the real considerations there in employing a lot of these technologies within that industry?
I love that question, because ethics comes up a lot in AI, and I'm not entirely sure why. I have ethics in place. Like when I develop any software application, anything, I'm going to make sure that it's well tested, that it works, it's not causing harm. As drug companies develop drugs, as doctors, prescribe medicine, ethics is a core part of everything we do. And then all of a sudden, this AI comes along, and everyone's like, we need an ethics statement around what we're doing with AI. Like, no, first do no harm. Okay. Let's start there. We all have the ethics and everything like that. So I am fascinated by the idea that we need a new ethics statement for AI. But at the same time, I do recognize it is a new technology. It has new, unique challenges, specifically around the idea that it does make stuff up. It does hallucinate. And we are getting better at figuring that out and overcoming those challenges. But again, people make mistakes all the time. We are not perfect. I was talking to somebody earlier and just the idea of empathy. It's like the computer, when they compare AI generated patient notes to those written by physicians, the computer is generally seen as more empathetic than the physician. Why that specific reason is, that's a whole other topic to explore. But the computer doesn't get tired. So there's one really easy reason why the computer can be more empathetic. As a human, I cannot keep up with the pace of research. So how do I apply the best medicine to my particular patient's condition? Well, think about that AI that's listening using the ambient listening technology. It knows what's going on with the patient because it has all the patient information. If you start bringing these other things where it's like looking at facial expressions to understand how you feel, becomes really powerful. And then it's aware of all the research out there. So, I think today, if someone were to develop a system like that, then the AI should surface the question to the physician. The physician can make, the informed decision then, like to explore that, and ask, pointed questions to the patient. But that's just it. It's like, how do we use it where it is, understanding that it's not perfect? Well, you and I work with people all the time that aren't perfect. And so it's sort of a change in thought process and how we use these systems, which is challenging. I recognize that. But yeah, it's the ethics statement is somewhat perplexing to me.
Yeah. I'm interested in your view, obviously within the healthcare industry, what do you see as some of the biggest problems right now that maybe you're working on or you see others working on? And then what are you most excited about as far as what the future holds within that industry and maybe some of the things that you're addressing as well?
Yeah, some of the projects and some of the challenges and things that I'm really looking forward to the next evolution is that personalization of the medicine. And it's the combination of wearable technology, so that we gain more understanding about what's happening within your body, I think, with all of that research and the power of generative AI to make a difference. I was part of a project 15 years ago when personal health records were just becoming a thing. And it was like, okay, how do we use these personal health records to empower the individual? And the technology just wasn't there. But imagine you're a person with diabetes and you're driving down the road and your blood sugar is starting to go low, which is a dangerous event. You could literally pass out if you're driving a car, or you could then crash and die. Tragic, obviously. Um, if the AI is monitoring your system, it can recognize this. It could have a situational awareness that you're driving, or potentially even stop the car. But I think today it's like, hey, you're having a significant medical event, you need to eat something, and just around the corner is a Starbucks. You better pull over and go grab something. But if you take it even like the step further of like, ooh, there's a Starbucks, or like a healthy food store, or we'll use McDonald's or a health food store. Like, okay, go to the health food store. It's like, you can't see it because it's behind McDonald's, but it's there. And the AI can tell you that. But then also with that technology can meet you where you are in terms of health literacy. It's like if you're newly diagnosed, you want to present the information differently than if you had diabetes or any other chronic condition or any condition for 20 years, multiple sclerosis, whether you're new to the disease state, there's a lot more education there. But, if you're living with this for, you've gained more knowledge and understanding and how it impacts you, that conversation changes with the AI. And how do you make that really personable? I'm still waiting for it. Like I wear one of the rings that are out there on the market and I track my sleep. And it's like, oh, last night you didn't sleep well. Well, if I had a drink the night before, okay, it's because I had a drink. But then there's nights where I didn't have a drink and I didn't have a great sleep experience. I'm like, well, what was it? And I want that level of specific personal information. Right now, it's generic. It's like, well, here's the things that could have gone wrong. Well, what was it? Well, as I reflect, the room was just too hot last night. But, can the AI tell me that because it's aware of the environment? So, yeah, I'm looking forward to that. And maybe it's hyper personalized information, care, treatment algorithms, discussions around my health. Because there's a bigger challenge in the US. We were talking about challenges before, and I sort of focus on the technology and the AI side of things. But healthcare, we just have an accountability problem. We have an obesity challenge. We have a mental health crisis in the US, if not the world. And how do we overcome that? We don't have enough doctors, enough people to treat and care for everybody that needs it. The technology scales.
I love that. The idea that we can, again, and we kind of go back to this regularly, like augment what people can do through technology, and the fact that we don't have enough doctors. And in another case a while ago, we were talking about we don't have enough home, like elderly care workers. So that's kind of adjacent, but how can technology start to come in and fill in or help fill in some of those gaps so that as we continue to grow in population, like we're able to get more attention and not less than we're getting now. And I'm absolutely with you on the personalization. I cannot wait as well. Like I wear smart devices and I'm able to track sleep and things like that. But I would love for it to analyze, hey, here's the patterns that are causing you not to sleep well. You had elevated stress this day and 2 weeks ago, and your sleep was not good because of that. And it looks like you may have been sitting and working up until an hour or two before bed. And that may be something that you want to avoid rather than just, like you said, the generic suggestions. Like, how can it really understand us and give us personalized either treatment options or personalized medication, that sort of thing? That is a beautiful future. All right. Well, I want to ask too, again, kind of going more, a little bit more broadly, what advice would you give to somebody who wanted to start a company or is looking to get into this space?
I'd say one, do it. We need the entrepreneurs out there pushing the boundaries. It's hard for large corporations to truly push the boundaries. Their systems are in place, they're entrenched, it's hard to change. So we need the entrepreneurs to improve the world. I think you have to find the thing that differentiates you. What makes you different? What makes you stand out? It's interesting as I've gone to some of these healthcare conferences over the last year, and Gen AI is big. There would be multiple startup vendors sitting next to each other going, we have ambient listening. We can summarize your patient notes. And I'm like, what makes you different than the guy 2 feet away from you? And a lot of people didn't have any answer. I'm like, you're doing the same thing. It'll take me a couple hours to spin up this. So you do have to understand of what that differentiator is, and get out there and challenge the world. In healthcare specifically, if you're not familiar with it, you do need to, one, have that support network and advisors, and really understand how the system works because it is convoluted, especially from a payment perspective. As you develop a product, the person who's using it, the person who's recommending it, the person who's paying for it can be completely different groups. So how are you selling this and getting it into the market as over the years? And I advise some startups kind of thing, and they're like, oh yeah, I'm going to create this app, and the doctor's going to recommend it to the patient, and the patient's going to use it, and the insurance company's going to pay for it. I'm like, that's rare. Or you'll get one hospital, one physician doing that because it's just really challenging. The doctor's got 20 different things going on. let alone being aware of your application. And, it doesn't make a difference if, insurance company want to pay for it. Is the patient going to use it? So yeah, you have to understand the very convoluted healthcare system that we have in the US to make sure that you can have an impact.
Yeah, I think that's a great call out. Well, RJ, this has been an amazing conversation. We've touched on a number of, I think, really fascinating topics. I've got a couple of wrap-up questions before we finish, but before we do that, where can people find out more about you, about the things that you're working on?
Yeah, corporate websites, probably the easiest, estenda.com, Estenda. My LinkedIn profile, lots of things. From the book perspective, I actually just ramped up productiveharmony.life in Instagram, Productive Harmony. Posting, start talking about this journey, starting to get a lot of feedback. We're expecting publication in late fall. But still, as I'm working with my editors, changing, tweaking, and stuff like that. And so just lots of stuff to share from that perspective. So love to hear what people think.
Great. Well, we will put those links in the show notes as well, so you can check that out. And we like to wrap up with a couple questions. These do not have to be business, entrepreneur, healthcare related, but certainly can be. And have you watched or read or listened to anything recently that you found particularly interesting that you'd like to share?
As I am in the throes of research around this book, there's one that really stand out that was sufficiently different. I really liked it. The authors was Dan Pink, and it was called When, The Scientific Secrets of Perfect Timing. I had to write that one down so I got the whole thing. But if you search Dan Pink and When, the word when, you will find it. And it's all about aspects of time and decision making. And it's just fascinating. It's a completely different way of looking at how you solve problems and when it makes sense to solve particular challenges. Seasons come into play, just all sorts of fascinating things from reading that book. I've bought more books than I imagined in the last 6 months, and that one really stood out.
Yeah, absolutely. I think that's a great one. I have to say, I don't know where it is on my shelf, but I have that one as well. I think that's a great one. All right. And then are there any products that you are using right now and enjoying that you found particularly useful, either a digital product or a physical product?
Two things. One, because it's sitting in front of me, and it's dry January, at least when we're recording this. Hop water, HOPWTR kind of thing. It has ashwagandha in it. I experiment with a lot of stuff. My wife often calls them potions. I'm always trying different products, different vitamins, different minerals, different supplements. So, okay, what does this, do? Does it make an impact kind of thing, particularly on my athletic performance? But I have a goal of living to 100 plus with a good quality of life, not just living, but good quality of life. So it's like, okay, what can I do from that perspective? And hop water just helps, it seems to take the edge off of that some others just really haven't had an effect on. And so that's been interesting. The thing I'm really looking forward to, I got it over the holidays, but I haven't started playing with it, is the Muse headband, MUSE. And it is a wearable to monitor brain waves, alpha, theta, delta. So like when you trying to go to sleep at night or meditate, you can use this feedback to be able to get into a deeper meditative sleep state or sleep better. So really fascinating to see what that reveals and how does that tie together with all the different metrics that are available.
Yeah, I have seen that and I find it very intriguing. I have not used it, so I'll be interested to hear how that goes and what you find from it, because that again feels like something that could be very, very beneficial to understand just your general state as you're doing different things, especially as you meditate and try and I guess center again on things or before you're sleeping as well.
Yeah.
Love that. Well, great. Well, RJ, this has been an amazing conversation. Thank you so much for your insight, for everything that you've shared. I think this has just been superb.
Thank you. I'm glad to be here. It's a great conversation.
All right. And thank you, everyone, for listening. Thanks again for listening. If you like the show, be sure to follow or subscribe on your favorite podcast app. You can follow the show on TikTok at prodigy.co and on Twitter at prodigyco. You can also follow me on both of those platforms at Kyle Larry Evans. If you want more product conversation, check out my newsletter Prodigy at prodigy.co. You can also follow me on Medium at Kyle Larry Evans or check out my Medium publication, Prodigy. Of course, you can check out all these links in the show notes.